Hello and welcome to this Air National Guard Medical Review Officer podcast update. I'm your host, Colonel Pat O'Brien, and welcome to episode 4. In today's episode, we will be going over a number of items that might be beneficial during this most trying time. The MRO program continues even while we deal with the COVID-19 pandemic. In an effort to simplify our jobs, let's go over several areas that we can work on if we have some time available. The first area that we can look at centers around our service members who have ADD or ADHD. These service members result in the majority of our legal prescription drug screen results. The first recommendation is to make a list of these members. Arrange with your health technician staff to send out a copy of the 1-year ADD/ADHD letter for them to get their providers to fill out. A sample of this letter may be found on the CarePoint MRO template file folder. Getting these letters done and updated on an annual basis, we will have less work to do in clearing these cases. Make sure that these letters are scanned into the service member's military medical record for ease of review. Once these letters have been obtained, have your clinic staff make a list of the anniversary dates of these letters and make sure 1 month prior to the expiration of these 1-year letters to get a new letter for the record from the provider. Getting an update of provider notes at the same time will decrease your load later on. This just makes life easier for both you and the service member involved. Another area that we can work on if there is some time available is to have the full-time MDG staff contact service members who are known to have chronic conditions to get updated medication lists from their pharmacy. Being preemptive and working on this on a regular basis will result in quicker turnaround of MRO reviews. It also allows for evaluation for medical conditions that were not necessarily declared by the service member. I have found obtaining these medication lists from pharmacies has yielded information, such as a service member taking methadone with no medical records noting a chronic pain or opioid requiring condition. It is a good time to remind MROs as well as wing DDRPMs that we want to discourage the copying of prescription bottles as documentation of what service members are taking. Many times the photos that are taken do not show enough information. It is much better to have an actual medication list provided by the pharmacy to review. One thing that can be done with service members is to have them file an ongoing release of information with their pharmacy and their medical provider so that all records may be readily obtained. We must always remember that as an MRO we are providers first. We want to make sure we are evaluating information we obtain during our reviews for possible profiles or waivers that may be required. This is especially true for flight crew, occupational medicine examinations, and PRP. Having a critical eye can save a lot of time later on when issues are found early. Another subject I need to bring up concerns the prohibition by the Air Force Judge Advocate of the use of state drug databases. This prohibition was established in 2016 due to the fact that there are different state requirements for the use of these databases, precluding use by military providers acting as an MRO. So I have to tell you, please do not use these databases when doing your evaluation. If your state allows the use of a database, it may be appropriate for other reasons other than doing a drug screen review. Please make sure to consult with your local SJA for a legal opinion of reviews of these databases for use in other areas related to patient evaluation. I want to reiterate a desire to have one naming system for all MRO MFRs. This allows the easy finding of these files when queries are made. Naming these individually utilizing the G code, which denotes the unit, and the LAN, or laboratory accession number, then makes that MFR unique to a specific specimen. An example is the name MRO MFR-G47-B2003456789, which would denote a specimen from my unit, the 134th ARW, which is G479. Remember, the LAN starts with a B for Brooks or a T for Tripler. I have had some wing managers have difficulty finding MFRs due to the inconsistent naming of the documents. Give me a call if you have questions on this request. Finally, remember, I am here to be your resource for anything that has to do with the MRO program. If your unit is shorthanded due to state active duty, let me help by covering for your unit in this time of need. Currently, I'm covering for 11 units and happy to do so. Please obtain permission from the wing or MDG commander or designee for me to help cover your needs. I also don't mind phone calls about anything else that I may be able to help with. I am happy to be a sounding board for your questions and concerns. I've been a physician for a long time and have a few years on me that gives me a unique perspective in many cases. Let me help where and when I can. I can be reached at 865-603-0303. So, take care, be safe, wash your hands, know you are not alone, and have a great Air Guard day.